Hello, I'm going to do a home care video today, and this is my patient's media release form. And Mary, is it okay if I discuss some home care improvements with you? She nodded her head, I swear. Okay. So this is my patient. She has dark glasses on. I'm just going to have it record me for the time being. So, tell me more about your home care.
So obviously I brush my teeth the first thing, and then afterwards I floss, brush my teeth again, and then use mouthwash.
So you brush your teeth twice?
Yeah.
What kind of toothbrush do you use? Like an electric or manual?
Manual.
Manual? Okay. Is there a reason why you brush twice?
I don't know, I just feel like it's like cleaner afterwards. After like you floss, getting all that like stuff out. if that makes
Okay.
sense.
And do you use? Oh, sorry. Did you say you use mouthwash as well? Okay. Do you typically use it towards the end of the day, or right after you eat?
Yes.
Right after you eat? Okay, that's good. So I see that we have a good foundation, and is it okay if I offer you some tips?
Yeah, go ahead.
So a recommendation I would like you to do is perhaps floss before you brush your teeth, and then after go in brush. That way you get that kind of same cleansing feeling. Because if you brush your teeth and then floss right after, you kind of feel like you miss that area. So you flush initially, and then go through. It'll feel cleaner. And what are you using to floss?
Just a toothpick, like the green one. I don't know what the brand
Toothpick? Oh, is it like that plastic with like a thin line on it?
Yeah.
Okay, and so I'm gonna grab a little monitor real quick. So, when you floss, you kind of go in twice, like, so like in like this and then in like that, or you just go straight down, straight up?
I go like in and then go into between the curves of like the gum.
Okay, that's good.
Yeah.
Yeah, that's great. So, you said you brush your teeth twice. Is it okay if I show you how I brush my teeth?
Okay, yeah.
So, I do see like a very common, super easy to fix error that people do is they would brush like in the center of their teeth. We want to like direct that towards the gum a little bit because that's where bacteria gets trapped, and then that's where like very easy to get cavities. So I always start at the front. Let me take this bad boy out actually. Oh, here it comes out. Oh, there we go. Okay. I always start like my front teeth, and then you're using a manual, correct?
Yeah.
So with a manual, you kind of want to turn a little bit, like in circular motions. Is that what you kind of do? Okay, so just like this, making sure you get into the gum.
Yeah.
And if you don't like, so you floss a lot, so your gums should be strong. But if you do notice a little bleeding, know that that's okay because it's like a new motion. And then like agitating the gum line is kind of like working out. At first it's gonna bleed, it's gonna be a little sore, but it's gonna get strong over time. So just kind of do this. And the most commonly missed areas are the very back teeth. It's just harder to reach in general.
Yeah.
Is it okay if I show you like a technique that I use?
Yeah, go ahead.
So, I would assume that this part is pretty easy for you to get, and then right here, it's just this very back part.
Yeah.
So, instead of just like jamming your toothbrush in there, just like take it slow, and then since this is the upper, you want to angle it down a little bit so you get more reach. So let's say this, you can only open this much. It's kind of hard to like push down. Just like rest on your bottom teeth, slide in, and then just slide up a little bit and just brush around there. And yeah, and these are all like super soft movements. You don't have to like go ham and all that. Same for down here. This is also a very commonly missed spot.
Yeah.
Just angle it down like that and just brush. Do you also like scrape your tongue or like brush your tongue afterwards? Oh, sweet. Then you know all about that jazz. So yeah, that's what I do for my brushing. Is there something that you like have a question about?
No, I'm good.
That's all good?
Yeah.
Okay. So, let me put this away and double check what I need to go over. So it seems that you're pretty knowledgeable in the first place, and with the tips I gave you today, do you seem kind of like more like you want to incorporate into your own home care? Okay. She nodded. Yeah. Oh, and when you're flossing, do you notice bleeding or
No.
no? Okay. Yeah, that's great. That's what I want to hear. And is there anything else that I missed that you would like to go over?
No, that's it.
All right, that's it.